Hello and welcome to another episode of the Daily Remedy Podcast. Today we're here with Dr. Neil Anand, an anesthesiologist and thought leader in criminal justice as it pertains to the opiate epidemic and the DEA's actions in it. Additionally, he's also criminally indicted for his prescribing practices, though that remains up for debate as to whether he is truly justified in his criminalization or not. Additionally, he served in the armed forces, specifically the Navy, and has a long tenured history of serving patients throughout the Philadelphia greater region. And with that, I'd like to welcome Dr. Anand. Thank you for joining us.
Thank you, Jay, for that nice introduction. I really appreciate it. It's a pleasure to be here. I really love the Daily Remedy podcast. They're truly a pleasure to listen to, and it's very much needed in the medical community. All these differing thoughts, different opinion leaders in the field of healthcare, as well as people who are marginalized. Physicians and healthcare providers within the healthcare community. So thank you for all you do.
No, I certainly want to extend that to you as well. Thank you for all that you have done. And for those who are not familiar with Dr. Anand's work, I think it's important to first understand his background and then what work he has done, particularly with his FOIAs, in trying to identify prosecutorial misconduct and judicial misconduct as it pertains to due process violations for practitioners in the opiate epidemic. So, Neil, before we begin with the set of questions, if you don't mind providing a bit of background as to where you were, where you are today, and how your work on data analysis has really shaped the narrative around the opiate epidemic.
Yeah, so basically, I went to I was born in Philadelphia, grew up in upstate New York, went to Rensselaer Polytechnic Institute, which is an engineering school. I did biology and philosophy there. But when I was very young, before I went into medicine, I was very into computers. I used to build my own computers, build my own integrated circuits. I was pretty decent at hardware, and I knew a little bit of programming. And I was pretty good in math and physics. Not stellar, but pretty good, above normal. So when I was targeted and attacked, I noticed, there's certain, groups of people that seem to be targeted more than others. I also started studying how so many doctors were being criminally indicted relatively recently, because when I was a medical student or when I was a resident, it was very infrequent that a physician or a healthcare provider got in trouble with the government for doing their job. Now I hear, either weekly or biweekly, reports of physicians and healthcare providers around the country being arrested. And for fraud. So where did all this fraud come from? That was the first question I looked at. And then I started speaking with a lot of these marginalized physicians or physicians who had been attacked, and started hearing their stories, as well as patients. And I started forming a picture. And then I realized when you're doing something on a mass scale like this, there's usually a process, or a detailed process, in order to attack a large group of people very quickly. You have to have a process. And I knew, based on history, I studied World War II history also in college, where they used computers and statistical computers to attack Jewish people or people who were considered a marginalized member of society, at the time mentally retarded or physically disabled, to be removed from German society. So these were some of my early thoughts, which led to me joining some groups around the country, some groups like Doctors of Courage, Physicians Against Abuse, and a variety of OPI, different physician groups who were looking into this process, and Louisiana United International, America United International, and trying to solve the problem. That led to the FOIAs and requests for information at the state and federal level.
Okay, so let's parse that down because there's a lot in there. We know that the DEA and the Department of Justice violates certain due process protections against patients and physicians in their search for criminal behavior, or at least what they presume to be criminal behavior. And as part of that analysis, they'll look at statistical outliers. If a physician has excessive reimbursements or excessive prescriptions, whether that's a truly meaningful data point or not, that's what they focus on. So knowing that and seeing that as a starting point, how did you then piece together the impropriety in that approach to criminal investigations, and what does your research lead you to find?
Okay, well, yeah, we would have to break that down, but basically, I'm pretty decent at statistics. I even went to Guinness in Ireland, and Guinness in Ireland, they're believe it or not, the beer makers really started the field of statistics. And what they tried to do was they tried to develop a uniform hops. They wanted each pint of Guinness to be exactly tasting the same. Before McDonald's, where each burger had to taste the same, Guinness wanted to have the same uniform outcome. So when they would test barrels of hops to see, they wanted to see what would be the minimum amount of barrels of hops to test to get the same uniform beer or same product. And that's how statistics was developed. And they developed something called central limit theorem. And central limit theorem said that you would need around 30, sample size of 30 to make a generalization about the whole sample. So you could take a sample and then make a generalization about the whole, population. Okay. What data analytics is a bastardized form of this process. What they're saying is that if you're an outlier, okay, then there must be something wrong with you being an outlier. But the problem with that kind of thinking is there's outliers in everything in nature. You have, bigger animals and stronger animals and weaker animals. You have bigger plants and stronger plants and weaker plants. You have Michael Jordan, who practiced every day, and he's an outlier because he's a better basketball player. Or you can say he's a cheater. I mean, some people say that Tom Brady could be a cheater. You have 10 kids who get 1,600 on the SAT. They could have cheated, or they could have studied hard and been smart. So it's that mentality is that, and those outliers will always exist. So if you take out 10 outliers, this is what the problem with the Nazis had. They would take out 10 or 20 or 30 or a million outliers, and that tail would still be there. This tail would grow back again. You cannot fix nature. Nature will always have some sort of distribution, a binomial distribution, a Gaussian distribution,
The
any
bell
data
curve.
set. Yeah,
You're referring to the bell curve.
Correct. The bell curve is a Gaussian distribution. So starting from that and the philosophical philosophy that the government is using in their criminal forensic tools, which they call data analytics, to discover fraud. I had a problem with that because Elon Musk, you could say he's a cheater, and some people do. I don't think so, but some people would say that, or Bill Gates, they're outliers. They made billions of dollars. Some people say, well, Bill Gates didn't even make this first disk operating system. He bought it from someone else and resold it.
IBM.
So, to IBM. So he bought it. It's called Quick and Dirty DOS, Quick and Dirty operating system, and then he made it into Microsoft operating system. So but some people are smarter businessmen. Some people are weak businessmen. Some people are better cooks. Some people are not as good cooks. And
Well, so let me ask you on
and
this then, because
yeah,
for the person who is not in the medical field and may not get this concept of distribution, just at face value, it seems suspicious if, in my case, where somebody has allegedly 6,000 pain scripts, whether that's a true number or not, it just sounds suspicious. So why shouldn't the government go after physicians in a situation? Why shouldn't they target outliers? And why is it important to have outliers in medicine? I get that you want to have distribution, let's say for evolutionary purposes, distribution as a general principle, but why is it important in healthcare? And why shouldn't the government rely on these types of outliers?
well, the outliers are the ones in every society that actually push the frontiers of medicine, business, um, any field. That's how you get progress. Is a lot of times from the outliers. Um, and if anyone who studied business also knows that a lot of times outliers happen because there's a scarcity, there's a supply demand effect. So, for example, if there's a new technology, for example, genetic testing, you see a lot of arrests for genetic testing. Genetic testing was a new technology that paid $10,000 or $5,000, and so a lot of labs opened up, a lot of physicians opened up because of that high price point, and that brings new market entrants into that field. But that also brings that supply increase will drop the price over time. Just because they were an outlier and made a lot of money by selling a lot of genetic tests or succeeding in that one area doesn't mean that's a criminal activity. That a lot of those are created by market forces themselves, the supply demand effect, or some other issue. So one, you're impeding progress. One, you're impeding expertise in a certain area. I mean, Microsoft sells a lot of software. That doesn't mean they're criminals. McDonald's sells a lot of hamburgers. And you have to look at, there are certain physicians who specialize in a certain area. That doesn't mean that they're doing criminal activity. You look at Mayo Clinic, they might be outliers in certain surgeries where they're them or Johns Hopkins or University of Pennsylvania or certain hospitals are doing all those kind of procedures. Why? Because they're a tertiary care center. There's other reasons than them being an outlier because they're cheaters and they're criminal. I mean,
Yeah.
we don't look at it that way in any other field or specialty, that they're an outlier, so they're a criminal.
So the
Being an
context is
outlier,
important.
yes.
The context is important. And I think you were the first to really highlight that in terms of what the data shows and does not show. And I think what it does not show is the absence of context. When you reached out to the DEA for FOIA documents that really analyze how they investigate physicians and healthcare systems, you were met with quite a bit of resistance, but you persisted nevertheless. And you've had some victories, and I think it's important to highlight what those victories are. So as we start to talk more about the importance of context and data, talk a little bit about your investigative efforts to date and what you're finding out so far through your FOIA efforts.
Okay, so I would say that my FOIA efforts at the state and the federal level, whether it's called Freedom of Information Law or Freedom of Information Act, or like, for example, Pennsylvania has right to know law, I made requests to get the equations and the data sets, because in any tool or any scientific process or any mathematical process, you need the raw data that is collected to see if it's reliable and valid. And then you have to look at the mathematical processes, the input, the actual processes, and then the output to see if that's reliable and valid. It has to be subjected to the scientific process, right? To show that that it's reliable, consistent, valid, and that it's not producing an erroneous result. So when I would ask these government agencies that are using these new clinical tools, or clinical tools or criminal forensic tools, or whatever way they're trying to measure something, whether it's criminality or measuring suitability of care or good care or necessity of care. They would never provide the equations. They would never provide the data sets. So when you gave me the example of 6,000 prescriptions, well, I need to see then the whole data set of everyone's prescriptions and every practice's prescriptions and every hospital's prescriptions. They can't just cherry pick and say, let's look at, Dr. Anand or Dr. Joshi and see how many prescriptions he wrote. Oh, he wrote 10,000. Well, we don't know what the median is. We don't know what the mean is. We don't see the whole data set. We don't know if they're excluding things, because you might be on the low end of the curve. You might be in the middle of the curve. You might be at the high end of the curve. But then you have to look at, a pediatrician might not write a lot of prescriptions, but if a pain management doctor would, that's like looking at, does a urologist do a lot of EKGs? Well, that might be a little bit abnormal, but maybe he's doing it preoperatively to make sure that when he does a TURP procedure or something like that, that they don't get congestive heart failure, some complications. So there are a whole bunch of reasons. And then there's cross-hybridization between some doctors, think of a brilliant idea and then they go into a different field or they expand on another field. Those things have to be looked into, and they're not by any of these agencies.
So we know context matters. We know that the DEA tends to exclude certain data. Can you give an example of a case that you may have found in your FOIA, or a case that may have been misrepresented in the public, in which the data was deliberately mischaracterized, either by removing the context or excluding certain factors?
Yeah, I mean, there's a bunch of cases that we've identified, me and a team of doctors, and it's been proved in court that the data was either fabricated or the data was totally erroneous. There's a case of Fusto. There's a case of Reddy Anaparetti. There's the case of
These
Dr.
are all physicians.
Yeah, these are all physicians where data was used in their trial, and statistics is allowed in trials. There was a case, I think it was in Florida, where somebody, I think it was a person, got the death penalty, but then when they actually statistically looked at where he fell in the spectrum of mental disability, they realized, well, that there's the tail end of the curve. You cannot just say someone's mentally retarded if they test at 70 or 60 or 50 or something like that, an arbitrary number, because there's a spectrum. And that's when statistics first started coming into the courts and being recognized as a science. But we know a bunch of cases against physicians where the data is erroneous or fabricated, even against Dr. Ruan, who just had a victory in the Supreme Court. Data analytics was used against him in his case. It was brought up during the trial. It was never tested. It was never verified. I reached out to the company, Qlarent Health Integrity, to ask them courteously, tell me how your systems work. How are you doing this against? This was 2 years ago. I, got no response. Dr. Leslie Pompey, who just had a trial victory in his case and was deemed innocent, he also sent a request. He got no response. The problem is when you're using something like a radar gun. If the radar gun says, 20 when someone's going 55 or 90 when someone's going 55, you can see how that could cause problems. It could not catch criminals, or it could catch too many criminals, and it could catch people who are innocent or not catch people who are innocent. I mean, the reliability and validity testing needs to be shown.
So let me ask you this then, because I think it's really important to highlight this. You talked about physicians who are wrongfully convicted or physicians who are eventually exonerated. Somebody who may not be familiar with how vast the government misrepresentation of data is may say, well, if the data is really false, a physician can simply battle it out in court. A physician would know how to fight against that. Explain why that argument doesn't hold muster when you're looking at the actual legal proceedings and how data is used in the court of law. Explain kind of some of the tactics. I think that's probably the best word. Some of the tactics the government uses to ensure that the manipulation of data goes unchecked.
Okay, so I would start from the very beginning. I mean, if there's no issues with the data or whatever or the process, just give it to us through the FOIA.
Yeah.
Why go through this? I mean, why do we have to litigate? Now we asked for it through a FOIA. Now we're litigating in Washington D.C. a bunch of doctors trying to get that information. I mean, you tried yourself. So we try to get. They're not giving that, number one. Number two, in these cases, discovery is given extremely late or not at all or till the very eve of trial. So a lot of this misconduct goes unchecked. Three, lawyers and physicians, for the most part, do not understand, for the most part, statistics or data analysis because, data analysis and statistics is mostly used by researchers and in the field of mathematics and certain other fields of industry like advertising, they use it. And even they abandoned it as a tool. I mean, they could not predict. Google, even with all your information perfectly, Facebook with all your information perfectly, they know a lot about you. They know what you're going to buy, what you buy. They get the CVS data. They buy the CVS data and your Walgreens data. When you get those coupons and your cards, they collect all that data so they can form a picture of who you are as a person. And they themselves cannot predict with accuracy what you're going to buy from one week to another week, which is why they have, they call it a conversion rate, of how much you're going to convert to buy something. It could be 10 or 15%. So someone with that much knowledge cannot make a prediction on you. How can the government do that? So that's what I'm trying to fix and solve and bring out to light. And I needed to come on your show and your program to get this information out there.
For sure. Now, let's do this because you and I are so much in the weeds of things. I mean, you're at the vanguard. Many people may not even be familiar with Trulerant or Bamboo Health or these organizations. They're shrouded in secrecy. Talk about what these organizations are and their relationships with payers, government entities, because I think that's important for people to understand when they are not able to process. How is it that a physician cannot defend himself or herself against obviously erroneous data? And why can't they just use the legal means to exonerate themselves? A lot of that has to do with how the data is produced and guarded and almost kept under a shroud of mystery. So if you can talk a little bit about Trulerant, Bamboo Health, and these other organizations, and the layers upon which the data is kept under secrecy, it would be really helpful for people to understand.
I got you. All right. Well, let me start out with there are things that are called junk sciences, and junk sciences do show up in the courts. Fingerprint analysis, for example, that people think is 100%, is not 100%. Actually, if you look up Google the Madrid bombing, FBI, there was a lawyer who the FBI was 100% certain that he committed the bombing in Madrid, a lawyer. Because they had a 100% match on the fingerprint. And they found out later, subsequently, that they call it frictional ridge analysis, is the actual proper term. Frictional ridge analysis is not 100% correct. Bite marks, that has been disproven. Carpet fibers and clothing fibers, that was disproven to be not accurate in courts of law. So there's these junk sciences. Now, where the data, like for example, Bamboo Health was purchased by Equifax. Equifax collects all information on people's work, their credit history, their salaries, because people who give their salary information or their information on credit cards from the salary, so they know how much money you're making on a credit application because they collect the credit application. Now through Bamboo Health, they're getting people's with controlled substances, they're getting it at their pharmacies, and they collect all that data. And then they sell that data. They don't collect that data for the benefit of the public. They actually sell that data to people like insurance companies, or the federal government. They give it to the federal government. So it's all people's private data that's being collected now, giving to people who have ulterior motives with that data. That's causing, I think, a huge problem, because people don't have that privacy anymore, and these systems are so complicated, and they collect so much data. I mean, hard drives are so big and servers are so big, they can collect every purchase you've made for the last 20 years, every salary you've had for the last 20 years, all your court history, all your history of the properties you own that's public knowledge because it's registered in a court of law. So they have so much information on you. That is what people don't understand for the most part. And it's hard for a doctor to understand and fight that in a court of law or prevent that from being introduced as evidence.
Why is that a bad thing, though? So let's say I'm patient, so on and so forth, and I'm seeing in the news all the time about patients overdosing and whether it really was caused by illicit prescribing practices or whether through diversion. That's not the fault of the physician. It just seems like physicians have some role to play in helping to curb this. It just seems like it. So if somebody's collecting, whether it's a third party entity, if somebody's collecting data, it would seem like that's a good thing. So explain how that leads to these erroneous convictions, these erroneous indictments.
Well, like I said in the very beginning of this podcast, we studied World War II history. The German Third Reich thought that if they could make the body of Germany strong by cutting out the weak parts of its total body population, that they thought were hampering the strength of Germany. But now Germany was totally destroyed by that process, because there's a top-down approach. I mean, not everything can be solved through a top-down approach. Things have to bubble up from the bottom. And someone who thinks, okay, for example, if we look at the opiate crisis, we've cut down opiates by 40%, 50%. We've arrested hundreds and hundreds of doctors. More and more people are dying. Why? Because maybe those doctors were actually helping the patients. Now, you get some unfortunate circumstances. Not everyone's perfect. Not every doctor's perfect. But on average, having a doctor helps someone. Patients getting medicines where the benefits are more than the risk, right? Because medicines are approved in this country through the FDA, and they're based on safety and efficacy. The FDA has a mandate that medicine should be efficacious and have safety. Well, if medications have benefits greater than risks, and doctors who are trained in this country, by seeing a doctor, you should have benefits greater than risks. And you remove now all those benefits. You get rid of the doctors, you get rid of those medications. Now we're having more deaths. And to me, that seems natural, a natural consequence of what people, the top-down approach. Chinese government did it in the Great Red Revolution. I think they killed a bunch of sparrows, and then the country was plagued by locusts. The checks and balances of a large system are not well known, and so a top-down approach sometimes is not always the best. And we see the consequences because all this erroneous data, nobody checked the data, nobody checked the methods, nobody checked whether something works or doesn't work. And now look at the consequences. It's devastating.
So let me make sure I understand this right, because I think it's a very important point to highlight. Healthcare is a balance. Everything has a benefit and a cost. All the drugs that are available on the market, all the medications available on the market have benefits and side effects. Just look at any pharmaceutical company and you'll see all the side effects listed, but they're approved nonetheless. So what you're suggesting is that by focusing on one metric in isolation or cherry picking the data that you want to look at, you're ignoring the context, you're ignoring the balance. And so you're removing a lot of the benefit for the sake of this perceived safety, but that perceived safety is really an undisclosed form of harm. And so that's why people get this notion of unintended consequences. Is that, am I on the right track? Am I understanding this cognitively as you're trying to explain it?
Yeah, I mean, it's the law of unintended consequences. It's common. It's common in the government. I saw it in the military. You know, I mean, look, we pulled out of Afghanistan after 20 years. What was really there to show for it at the end of it? You know, I lived through 9/11. I was right there when the towers got hit. I was the youngest doctor there, and I joined the military right after that. And I saw the law of unintended consequences play out when they invaded Iraq and Afghanistan. And so, you know, I'm not saying it's always a bad thing. You know, a top-down approach is always a bad thing. It's used in a lot of situations, but it can also cause problems because things aren't thought out 100%. Contingency plans aren't thought of, and you know, obviously these medicines have been used for thousands of years, and they've been used safely for thousands of years, and they're trying to save lives, but you know, you can try to save one life and kill a million people to try to save one life. You know, the government, you know, I don't think factors those into their equations. Politics doesn't factor those things, and that's why medicine and science and doctors like yourself and doctors around the country have to look into these things and try to obtain the actual information and then approach the powers that be and say, look, we examined these inputs, outputs, and the process, and there's errors, and those errors are magnified by the process, and you're getting the opposite result, and you need to stop this before it gets out of hand and before you become the Third Reich Nazi Germany.
So, with the insights that you've gleaned through your efforts in reviewing the data and litigating FOIA, what are some solutions that you see? If, God willing, the DEA says, I'm willing to hear possible solutions and curb or unintended consequences, revise their ways to be friendly to patients and physicians, what are some solutions you would offer to them?
Well, I'd say the first thing is to look at the data set. We know through the National Practitioner Data Bank, I'm just talking about this immediate issue. From the National Practitioner Data Bank and the OIG exclusion list and certain lists, we have a list of doctors who have been determined to be bad or bad actors or criminal doctors or criminal healthcare providers and whatnot. And so we have the output. Then we have the data sets, which is the input. What are they looking at? You know, we need to know what data sets they look at. ARCOS data, billing data, prescribing data. What are the data sets? And then we have to look at the intermediate process, which is the equations, how they do the processing of the data to get the output. And see, is there producing errors? Is there reliability? Is there validity? Is there testing that they did to make sure that you have a accurate result, or you're actually doing the right thing, or if it's prejudicial to one group of people or another group of people, because we've looked at the outputs, right? Because we looked at. Remember, I talked about central limit theorem in the beginning. If you look at 30, a sample of 30, you can look at it as a representative whole and be pretty sure that if you've sampled 30, it'll represent the whole, correct? Well, we have a list of 1,500, say, physicians and healthcare providers, and we found abnormalities in that. For example, elderly physicians seem to be targeted more than younger physicians. But that doesn't make sense because an elderly physician should have experience. You don't say an older judge or an older lawyer or older mechanic or an older, so at least someone who does cognitive things. The experience does matter. So experience should matter. So older doctors and healthcare providers should not be, criminalized more than younger physicians who know less. Older doctors should also be less greedy or have improper motivations, because toward the end of your life, I mean, most people become more spiritual. There's less need for money for their family and other needs. So older people should not be targeted. There seems to be racial targeting, religious targeting, and we want to get all the data sets to make sure that's not happening, because that's a 14th Amendment violation. So we need to look at all of those things, and that's what I would go to the DA and say, look, give us all this data, give us what we need to look at, so that if there is something wrong, if you guys are doing something wrong, then we can correct that before, the whole society is lost. Like in the German Third Reich, they thought if they killed 6 million Jews, Europe would be better, but it turned out to be the exact opposite. So that's what I'm trying to do, and that's what I'm trying to get help with. Not just, even internationally, we reach out to United Nations, ask for their help into looking into this, so that our findings that are disturbing don't continue.
Well said. And so with the remaining time that we have, I'd like to give those listening an opportunity to get a hold of you and, if interested, support your efforts. So for those listening interested in getting a hold of you, what's the best way that they can reach you and provide support for your efforts?
Okay, one way someone can reach me is they can contact me through email. I have one email, cardiacgasman@gmail.com.
Could you spell that out for us?
Yeah, cardiacgasman@gmail.com. I can also be contacted by Doctors of Courage because I do a lot of work there and help that organization. So if someone can reach out to Doctors of Courage, other ways they can reach out to Daily Remedy and receive my private information. If need be, if someone wants to reach out to me privately, I will give my private information to you, Dr. Joshi, to give to someone.
Just add that in the comment section below, and I will help that out.
Okay, and the last way is that someone can reach out to me is through I have a fax machine. You can reach out to fax 215-940-9690. So anyone can fax me any information that they have.
Spoken like a true doctor. Fax me. That's awesome. Dr. Anand, thank you so much for your time.
Thank you, Jay. I appreciate it.